So, I had my consultation with the new RE this morning. It didn't go how I wanted it. So I'm just gonna kind of skim over what happened. Okay, so I have this piece of paper going over today's visit. So, okay, here we go. It says egg number, which means how old I am, I guess. Of course, I'm 29. So, ovulation, it says 35 to 45 day cycles. Unknown uterus, which means they didn't do any kind of ultrasound today. All they did were my vitals. Sorry, I'm in the hospital parking lot because I'm getting ready to go in to see my grandpa. Anyway, it says tubes, HSG, in 2013, which was my last HSG. It was normal. So he decided that we don't have to do another one. They are going to retest Stanley's semen because the last time it was done was 6 years ago in 2013. So we're going to get that redone. Past cycles, Clomid 1 cycle, injectables 2 cycles with IUI, had successful pregnancy with my second cycle. Medical issues, migraine headaches with Aurora, my BMI, PCOS, and ATM gene mutation. And then other issues, like when my mom had breast cancer and how I've had chickenpox. So the plan is what he's saying. The plan wasn't exactly how I wanted it to go. This, this ATM gene mutation has taken over my life completely. And I have already cried about it today, so hopefully I don't make this into a blubbering mess. But it is completely taking over not only my mind, but it has taken over now my fertility because, you know, I'll get into that right here. So, number one, I'm going to call when I have my menstrual cycle, which should be, I ovulate next week because I just got over my cycle. So, and then they're going to check the labs to evaluate my ovarian function. So they're going to check my FSH, my LH, my estradiol, and my AMH on day 2, 3, or 4 of the cycle. They're going to check my TSH, fasting prolactin 17, hydroxyprogesterone, my hemoglobin A1C, my testosterone, fasting blood glucose, because he said something about, because I know with PCOS, women do get diabetes. So I've had multiple blood works when it comes to my glucose, and I've never had an issue. I was told that if I would have an issue, it would be during pregnancy, and I never had an issue even when I was pregnant with my daughter. I'm sorry I'm so down low too. Like I said, I'm in here. Let's go up here a little bit more. There we go. I'm in a parking lot, and I really don't want people just to stare at me if they see me talking to myself on my phone. Okay, and they're going to check my prenatal labs, including my rubella, blood count, blood type. They were going to check for varicella, which is chickenpox, but since I have already had it, they took that out. They're going to check my preconception genetic consult. Not going to check. I have to have a preconception genetic consult because I do have the ATM gene breast cancer mutation. And so there's a lot of things that I have to do with that before I can even start my fertility treatment, which really upsets me. But I kind of, at first I was so angry that I was crying because I was so angry that I did not get what I thought I was going to walk into. Like with my daughter, I had, I didn't know I had the ATM mutation, so we didn't have to go through any of that. So it was pretty quick starting, when we were starting fertility treatments with my daughter. So that's how I was walking in thinking that. I didn't think my breast cancer gene mutation would cause so much hiccuping in this whole process. So this kind of puts us back like 2 months, guys, and it really upsets me because I don't have 2 months. Anyway, so then they're going to check infectious disease screening, which I've already had done, but they're going to recheck again since it's been a couple years. I definitely don't have HIV, hepatitis B or C, syphilis, gonorrhea, or chlamydia. So I know I'm okay with that. They're going to check an initial pelvic ultrasound. They're going to make sure my pelvis is where it's supposed to be. Make sure everything is sitting where it's supposed to be sitting. And they're also going to check sono HSG. They wanted to check, like it says here, test evaluate if ultrasound is abnormal or if desired. So he said that we don't have to do another HSG, because he doesn't think things would change. He doesn't think it's necessary to do to do another HSG. So I'm okay with that because the HSG is hell. I hated doing that the last time. Of course, check Stanley's semen analysis. Forward my recent PAP, which was last March, which was normal, so we'll be okay there. I'm going to continue my prenatal vitamins. I don't take actual prenatal vitamins. I only take 800 milligrams of folic acid. And then, weight loss is another thing. He did not, I asked him about the keto diet, because I've heard a lot of people say that it's good for PCOS, but he said not to do the keto. He doesn't want to do high-fat diet. So I'm not doing keto, so I'm just going to cut out a lot of things and just start exercising some more. And here's the next step 14. Step 14, I have to get the okay from my breast surgeon to even start any kind of fertility treatments, because the fertility treatments include estrogen. And my mom's breast cancer was estrogen positive. So they have to make sure that this isn't going to cause any kind of tumors to start to grow or anything like that, which now that I sit and think about it, I'm okay with it. If above workup is abnormal, follow up once above workup is complete and discuss the next step. If above workup is normal, okay to proceed with letrozole, which is Femara, 2.5 milligrams, and then that's what we're going to start with, and we'll adjust the dose as needed. And IUI. And they'll do that for 3 cycles, and if not successful, then we will consult. He was talking about doing IVF just for the simple fact to make sure that next baby, what they could do is they could pick an egg and genetic test it to make sure it doesn't have the ATM gene mutation for breast cancer. But I told him I didn't want to do that, because I don't want to mess with genetics. I don't want to have the full test tube type of baby thing where they mess with the genetics, and I just don't want that. So, and he was trying to push IVF on me, and I don't want to do IVF at all. Unless it's my last resort, IUI is no longer working like it did with my daughter, then we will talk about IVF. But at this point right now, I do not want to do IVF. This is how, like I said, the ATM gene mutation has taken over my life. And over, what I want to do. But then, he also said, you don't have to breastfeed as long as you want. If this takes a year or so, then so be it, which is true. So be it. If this takes, because it's going to take a little, like a month or so to even get into into the breast surgeon. And I had to call my OB's office today because I need a referral. He can't do the referral. So I had to call my OB's office to get a referral to even see if I can get a referral without going in my OB's office and getting checked out before I go and get a referral. If that makes sense. Which I think is kind of stupid, but that's just me. So I have to go get the referral sorry, my phone's going off. For the breast surgeon, and make sure, and what she'll probably do is maybe a mammogram or an MRI of my breast to make sure that there's no active tumors or something like that, because if I were to start the treatment and the estrogen causes me to get breast cancer, and I get pregnant, I mean, it's either me or the baby, and that's a whole nother ball game that I really don't want to get into. So I'd rather be safe than sorry. So I want to get the okay from the breast surgeon before. So I'm thinking probably we'll start treatment maybe maybe April if I'm lucky. So it's just, I wish I would have started this earlier, but I wish, of course, I would have known that this gene mutation was going to take over everything. And that was his main concern the entire appointment, was this ATM breast cancer mutation. And I hate that. Like, I kept telling him, I was like, I've been fighting myself for so long, because I've known about it for about 2 years now, but I've been fighting myself for so long because I don't want to know. You know what I mean? Like, I know I have to get a bilateral mastectomy, and that's okay. I mean, I'll get that done, and I'll get new boobies, and, you know, but I didn't want to do that until my time was, you know, it was time to do it. So that is my update. I walked in with high hopes and came out crying like a big old baby. It sucks. It sucks to know that this is all I have ever wanted. It's right there in my reach, but then there's just something slapping my hand saying, no, you can't have it. So that is the update. I will update again once I get a call from my OB's office about the referral. So we'll see what happens. But right now I'm going to go in and I'm going to give my grandpa big hugs. So, guys, keep me in your prayers. For, you know, until we start treatment, we're just going to keep trying on our own and hope it happens like it happened when, you know, in September when we got pregnant on our own. So crossing my fingers that maybe it does happen on our own and we don't have to continue with this, with the fertility journey, because I got a really bad vibe from this new doctor. I just kept thinking that all he focused on was how I had this gene mutation, but maybe that's just because it needs to be focused on. I don't know, but I'm going to get off here. So y'all have a beautiful day, and I will talk to you guys later.